Hello, everyone. Welcome to today's webinar where we'll be exploring the power of technology in healthcare credentialing. I'm thrilled to introduce our three speakers who will be sharing their expertise on how innovative solutions are transforming workflows. First, we have Ron Gonzalez, CEO of Una, who will present how technology can enhance productivity and streamline onboarding in a talent-driven market. Next, we have Sarah Plumley, our Chief Customer Officer at Credentially, who will dive into data-driven insight, showcasing benefits of streamlined credentialing. And finally, our guest of honor, Brittany Rosenberg, Director of Credentialing at Health Carousel. She'll be sharing how her team leverages these innovative solutions to transform their workflows. At the end, we will close off with some questions, so feel free to ask anything. Now let's get started. Ron, floor is yours.
Thank you so much, Jen. Let me move into the slide here. Start presenting. Good morning, everyone. With so much valuable information to cover this session, I'll dive right in and share my vision for developing technology that enhances productivity while embracing the evolving talent-driven market. Let's start with simple. Candidates are seeking straightforward, user-friendly interfaces so that they can onboard efficiently. These demands are often set by healthcare facilities and staffing companies, so efficiency is key. When technology becomes overly complex or difficult to navigate, candidates tend to lose patience and move on to an easier alternative. Over the past 5 to 7 years, automation in technology has rapidly gained momentum. And with the rise of AI, recruitment, onboarding, and compliance processes are undergoing significant transformations. Staffing companies will face a new challenge, needing to relinquish some control and reduce hands-on involvement, trusting AI-driven systems to manage key processes and workflows. This shift is essential, especially with the new generations of clinicians entering the workforce who have grown up immersed in technology. For many of them, constant interaction through text and notifications is the norm, with some even preferring to communicate with recruiters via text rather than traditional phone calls. Trusting these tech-driven interactions will be key to adapting successfully. In the following slides, I will demonstrate how we have utilized data within our organization to drive marketing initiatives, differentiate ourselves from the competitors, and gather valuable feedback from clinicians on their experiences. This data has been instrumental in identifying opportunities for improving our tech to further enhance clinician engagement. A couple of years ago, during a research study, we aimed to quantify the effectiveness of our platform in engaging clinicians to complete required testing and checklists. We had always believed in the power of Una's user interface and its ability to streamline these processes. But we wanted concrete data to back that claim. The study involved a large national client that was transitioning from a competitor to Una with a data set of nearly 10,000 clinicians. What stood out immediately was a significant reduction in time it took clinicians to complete their competency exams and skills checklists on our platform. However, the most compelling data point was something we hadn't focused on initially: the completion rate. On average, 8 out of 10 clinicians using Una completed their competency exams compared to only 5 out of 10 on our competitor's platform. This highlighted not just Una's efficiency, but also its ability to keep clinicians engaged throughout the entire process. Next slide here. Okay. In an ongoing case study with one of our current clients, they have been sharing a survey link directly with their clinicians after completing their tests or checklists. Since the candidate experience is pivotal in engaging clinicians, we've made design a top priority. By continuously gathering feedback from the core users of our platform, we're able to iterate more quickly, delivering key enhancements and addressing any issues to further improve our technology. With an N of 242, the pie charts show that 99% of clinicians find Una easy to navigate. 96% say UNA's content is relevant, reflecting current clinical practice. And lastly, 7 out of 10 candidates complete UNA on their mobile devices. In our market, data is invaluable. It allows us to refine our platform, respond to users' needs efficiently, and empower our clients to make informed, data-driven decisions. Ultimately, leveraging this data helps us deliver a superior product while ensuring that our clients are equipped with the insights they need to enhance their own operations. With that being said, I'd like to turn this over to Sarah from Credentially.
Thanks, Ron. Good morning and welcome. I'm Sarah Plumley, Chief Customer Officer, and worked at Credentially now for just over 3 years. Nice to see you all. I think you'll all agree that it's surprising that in this today's age, there's still organisations out there that use spreadsheets to track HCPs onboarding and compliance. There are huge risks associated with this. Manually keeping data and critical compliance requirements up to date is not only high risk, it's often not sustainable in any profitable or growth-led environment. There are a number of key benefits, I think, of having a centralised credentialing tool, and I've picked out a handful to focus on a little bit more detail today. So firstly, transparency across your organisation. So here we've got a couple of dashboards as examples, but basically tools available for a credentialing manager and a recruiter to drill down into their own caseload and tasks. In particular, giving full visibility to a recruiter, but at a restricted level. So recruitment decisions are maintained and managed you know, within the right control. Having a centralised tool that can give full transparency, including team managers, credentialing managers and recruiters, enables all individuals access to the real data and statuses, and they can all give a HCP a nudge in the right direction when they engage with them. And on a practical level, the recruiter has full transparency, and a HCP level, they know that you as an organisation are totally aligned in getting them into work in a compliant and also in a timely manner. Now, auditing and compliance. You know, another sort of key point. In reality, any audit is going to cause a huge disruption to in a business, and there's huge organisational risk if it's not successful. More often than not, there's several key people out of the business for days just preparing files. Having a tool which contains everything that the Joint Commission wants to see, including all compliance requirements and really importantly, activity history, in particular, why decisions were made, who's made them, when they were made during the recruitment process is really important. Saves having to go trawling back through people's inboxes, emails to see, to understand, if you like, why decisions were made in the first place. So having a file ready to share can literally shave off days of the prep process and give everyone the confidence that there's been a solid, consistent approach to maintaining a compliant HCP. Then moving forward, then we've got real-time notifications. So moving to having real-time notifications is for your critical compliance requirements is an absolute must in today's world. An automated approach to nurses, SAM, OIG are really sort of no-brainers. To move away from those reactional manual checks, which really just leave you vulnerable to litigation, really is vital. in 2024, there is no reason why we shouldn't all be getting real data in real time. And again, it's surprising how many people are not working in that way. A good example, I think, is making sure that you've got a tool that gives you real-time nurses notifications for a HCP in all states, not just the check that you've done in the states that you placed them to work in. It gives you the complete picture of that individual. And then last, but definitely not least, I think I wanted just to touch on a fully centralised and automated document management system. A tool that can alert HCP consistently, weeks in advance, to keep their documents current, but also giving your organisation full transparency around maintaining a high compliance rate, typically working on average of 50 to 60 documents plus per HCP. I know Brittany and I've talked about previously about her relief that Health Carousel operates at a high 90s percentage for their compliance, and that has real confidence that they're not operating on a day-to-day basis with any expired documents. You know, a tool that can give you an organisational overview, but at the same time, you can, you know, within a couple of clicks, that you can sort of click into that staff member's profile and have a look at the granular detail. You know, it really is the norm now, you know, for Health Carousel and the way they operate. Having said that, I think it's probably a great moment to hand over to Brittany. Brittany, would you like to introduce yourself?
At Health Carousel, we're really focused on improving lives and making healthcare work better. So in my department, it's very important that we're getting our quality nurses and healthcare allied professionals to work. But we have to make sure that we're doing it in a timely fashion. We have to make sure that we have quality nurses and that they're competent and that they are ready to go to any healthcare organization that needs them. So one of the biggest things that we saw was we've reduced our credentialing time. So pre-credentialing, we were averaging about 20 business days, and we've gotten that down to 10, and we have aspirations to further reduce that. That allows us to get our candidates to the places that need them in a timely manner. So then they can get to work, they can make sure that we're getting what we need. The other thing that we really saw is our processes. We streamlined all of our audit processes. I'll use, since we're coming into October, for flu, for example. With the flu, I can go into Credentially, pull a list and say, okay, this is exactly what we need to do. What used to take over a week time now can be done in a matter of minutes. So I can have my credentialing specialists really focused on providing our healthcare professionals with the customer service that we expect, right? They can actually focus in on getting that one-on-one attention to all of our customers, just by not having to track all that stuff. So let me go to the next slide. Okay, so why we really focused in on rewriting the credentialing process. One is, I always say that credentialing is on a stage, right? We have our account managers, we have our recruiters, we have our clients, we have our customers, our healthcare professionals. So by the time we were able to give updates to all of those different people, the update was outdated. So the efficiency that is able for those for our recruiters, our account managers, to be able to get in the system and say, okay, this person's 90% done, and they can see exactly where we stand. They can see the notes. But from our perspective, our documents are still safe, right? They can't edit it. They can't modify it. They can't download it, right? But they can see exactly what's going on with their candidate. The next one is streamlined admin processes. This is absolutely huge. Health Carousel is really focused in on making sure our healthcare professionals are our number one priority. So when you take away those admin processes of, you know, the things that have to be done, the OIGs, the SAMs that you're constantly checking every 30 days, I don't have to worry about that now, right? I can focus in on making sure that my candidate has exactly what they need. They have my whole attention, and all of that kind of manual admin work is completely taken care of, and I don't have to worry about, is it done? And then the last one is the fluid integrations. So on average, we are credentialing specialists for probably in about 20 different tabs, right? 20 different platforms that they have to kind of bounce around and check this and go back to that. And so with the integrations, they're in one spot, right? I have all my work in one area. And so I'm not wasting that time to jump around and trying to give an update. Wait, let me look here, let me look there. It's right in front of you. So that's been a huge benefit to the team. I personally, as the director, love the notifications. So I actually will get notifications every morning I'll use the licenses as an example. I get an email every morning that I will, if anything changes to a license, if an expiration is about to come up. Every single morning I have that, and we haven't missed any issues with licenses since we launched that process. So for us, it's really, we want our healthcare professionals to know that they're the most important part, right? They're the ones that are going to the front line. And with our credentialing specialists not having to worry about all the busy work in the background, they can really focus on the healthcare provider and getting them exactly what they need, making sure that we're sending really good quality nurses to work without having to worry about all the kind of admin work and stuff in the background. So we really have loved this. I think we've been in for about 3 years now. Well, 3 years to get to where we are. And it's been absolutely incredible. And we have, now that we have this centralized, we've gone through one joint commission audit with it. And then we have, we're starting to add in more, right? So our benefits team can actually add in more documents so that this is truly our personnel file for our healthcare professionals. So it's been a crazy ride, but it's been absolutely awesome to get everything in one spot and really make our relationships better within the company, right? So I'm not, the recruiters know exactly what's going on. So it's been a very good transition. And it's really helped simplify our process, which I like to call it the thoughtful pause. And so we take the time to make sure that these nurses are ready to go. And so it's been amazing to be able to do more with less.
Awesome. Brittany, before we transition into questions, want to talk a little bit more about the Joint Commission and maybe how all this automation and visibility has allowed you to move through that process. So what was it like going through an audit before all this goodies, and then what does the process look like now?
Right. So during the audit, we go through the files. What's really nice is that because of the versioning, we have all the documents in one section. So I can say, Jane Doe, I'm going to use you for this audit. I can click through all of her documents and the previous versions. So say her BLS card expired during the assignment. It's just one click. Previously, I would have to go and get it out of a different file. So it's actually, it reduced our time for the audit because we were able to give them the documents so quick.
Understood. That's awesome. So I do have some questions. I'll start with you, Brittany, since I still have you up. Brittany, what advice would you give to other healthcare organizations struggling with compliance and credentialing, especially when considering the integration of advanced technology tools to streamline their processes?
So I think my biggest advice would be to really take a thoughtful pause and look at it from 10,000 feet. When you're looking at your compliance department as a whole, and really what are your processes, what are your workflows, then you can really create a program that every time that someone comes to credentialing, they have the exact same experience. They know exactly what's going to happen and there's no surprises, which in credentialing is kind of the biggest part of it, that we get thrown off with unexpected surprises. So to be able to start the program, look at it from 10,000 feet and be able to say, this is exactly what we're going to do. These are our processes, and just continue to follow those.
Awesome. Next question's for you, Ron. Question for Ron. With the increasing demand for user-friendly platforms, how has your technology ensured a seamless and efficient experience for candidates while meeting the fast-paced requirements of your staffing agencies and facilities?
All right, so there's actually two parts to this question. On one side is focused actually on the client side. We actually created Una out of the box with an API toolkit that kind of connects to platforms like Credentially, because we know many organizations, excuse me, don't live in an Una platform. They would live in a Credentially platform. So providing that interface on the compliance side so that compliance personnel don't have to log into Una creates an efficient workflow on the for internal employees. For all the travelers and healthcare travel professionals, we've actually done a few things to provide a real seamless experience for them and efficient. We actually shortened the length of our competency exams, but created different style of questions that are more scenario based. And that includes additional KSAs or knowledge, skills, and abilities to help the clinician critically think, right? So we do shorten the exams, but we collect more data and we don't compromise on the quality of the testing results. And on the skills checklist, we actually took what historically was two scoring keys and combined them into one. So just by doing that, we actually cut our skills checklist times in half because they're clicking once and not twice for each item.
Got it. Thanks, Ron. Another question for you, Brittany. Can you share how integration of automated credentialing tools has helped your team transition from manual process to more efficient system? And what operational improvements have you seen as a result?
Yeah, so we definitely have seen a huge difference with it. So what we're seeing is a lot of times we were taking a process and we would have to go manually into that platform, save the document, download it, save it somewhere else, title it, and then track the expiration. Expirations are huge because with credentialing, the process doesn't end when the candidate starts, right? We have to continually be on top of it. I would say our biggest pain point was that managing of expirations, right? You were downloading it and creating a spreadsheet and updating it. Oh, I've called this person, or, making notes of where you stand with it. By eliminating that, we are able to just pull a report, and then I can make notes and say, yep, this person is scheduled for this date. And then I'm taking out that kind of admin work of going back and forth and trying to figure out where we stand. My credentialing specialists are able to just get into the system. Here's my people that I'm working on. This is exactly who I need to address. And I'm not going to 10 different platforms to do those repeat tasks, right? So they're actually able to just go in, prove it, move on. And what was the second part of the question? I forgot.
Second part was, and what operational improvements you've seen as a result?
Yeah, so I would say our biggest improvement is our expirations. With the manual process, there were misses. Now that we have everything in there, my managers are able to audit. My managers are able to see their teams and where they stand. So you have more eyes on it, and you're able to really get in there and say, yep, everything's good to go. Or, oh, I need to raise a flag because I'm worried. So I would say just the overall quality really is what our process, all the processes change for us.
Awesome. Another person asked a question, how long did the implementation take? Now that's going back a few years, so I'm not sure if you remember, but I could answer that in a general on average answer. So general on average, it's dependent on how many facilities and how many clinicians and the complexity, but the average implementation in our system for us takes about 4 to 6 weeks. How about yourself, Ron?
I'm sorry, say that, you cut out for me.
How long does a standard implementation take with Una?
Yeah, it depends on the size of the organization. So small to medium sized organizations generally take just a couple of days to a week or two. Larger nationals are probably 30 to 60 days on average.
Awesome. And I think I do have one last question. Ron, given the rise of automation and AI in onboarding and compliance, how has the shift helped staffing companies reduce friction in the hello to hire process? And what impact has it had on overall efficiency and compliance? You got 3 minutes.
Okay, I'll try to wrap this up. I'm going to piggyback off on what Brittany said for some of the tasks that her compliance personnel were doing internally. Years ago, before automation, people had to enter data themselves or follow up themselves with task, a to-do list or task list. But now with platforms similar to Credentially, you're able to really automate a lot of those manual processes, right? And so it takes kind of although you take the human aspect out, it's really not required to send notifications or reminders out to your clinical staff, right? So I think hand in hand with human touch and automation and AI coming in the near future in this industry, I think it's really important. And you'll start to see compliance onboarding timelines to start to shrink, right? What was the second part to that? Maybe I answered it in my response.
Yeah, you did.
Okay.
The next one is for you, Brittany. We still got another 2 minutes. How long has Health Carousel been using Credentially for?
So we have been fully in the system, and Sarah may have to correct me if I'm wrong, since 2021. So we really, coming out of the pandemic, really saw a need that we have a great internal system, but we really needed something dedicated to credentialing. With all the changes through the pandemic, all the regulation changes, that's where we really sought the need. So we worked really hard with Credentially to say, yes, this is what's going to work with our quick turnovers, right? Our candidate is on assignment for 13 weeks and goes to another place that we can really quickly move them around. And so we started in 2021. That was a really drawn out answer.
No, that's okay. That's amazing. So now that I'm just going to conclude it. I'm very grateful to all our speakers for coming and doing this for us. I do see a lot of other questions, and I apologize we can't get to them all. So at the end of the webinar, we will send out an email to everybody. We'll provide the answers to the questions we didn't get to. We'll even provide answers to the ones that we got to. And again, really appreciate everybody for coming and spending the last 30 minutes with us. Hope you all have a great day.